Hello, everyone, and welcome to the latest in the webinar series hosted by the Kissimmee Osceola County Chamber of Commerce. I'm John Newstreet, the president and CEO of the Kissimmee Osceola County Chamber of Commerce, where our mission is to be champions for business and community. Today's program is sponsored by another champion partner of ours in AdventHealth, and we have one of their great doctors today to have a conversation on Heart Month. It's Dr. Solano. Dr. Carlos Solano is an interventional cardiologist with AdventHealth. We welcome you to the program. Thank you for being with us, Dr. Solano.
Thank you so much. How are you?
Yes, I'm very well, thank you. So this is a very pertinent topic today because February is America Heart Month. And so you may see a lot of folks wearing red. You'll see a lot of conversation about what this means. And so could you talk to us a little bit about why we recognize February as American Heart Month and maybe some of the leading causes and how we can prevent any bad modifications to the most important muscle in our body, probably, right?
As you know, heart disease is a leading cause of death in men and females in the United States. So, and despite all the efforts, to decrease heart disease, this is the first cause of death still for both, genders. So the idea is try to prevent heart disease instead of trying to fix it afterwards. So the main goal and what I would like to stress during this conversation is the importance of prevention. So we try to identify and actually decrease the risk of developing heart disease by identifying and treating the risk factor for heart disease. That includes doing frequent checks of blood pressure, cholesterol, blood sugar throughout diabetes, and treat them accordingly if necessary. And also trying to implement healthy lifestyles, trying to exercise more. What is recommended is about 150 minutes per week of light exercise or 75 minutes of high-intensity exercise, trying to have healthy substitutions in food, trying to increase the intake of fresh fruits and vegetables, trying to decrease the salt, fat intake, and also trying, to have some good support, some good rest, trying to decrease stress. All those things can contribute to decreasing the risk of heart disease.
So we're in February, and it's still early in the year. These years seem to go by so quick, especially with the pandemic. But, we talked about goal setting, and so you still have a lot of time ahead. Talk to me about goal setting, why this is important, maybe how best to implement that in your healthy lifestyle.
Yeah, so actually there are some guidelines that make some recommendations about what healthy, lifestyle means. So in terms of exercise, what the guidelines recommend, and it was recently updated last year, is to have some light exercise like walking about 150 minutes per week. So if you divide that within the week, you can say that you can exercise lightly, 30 minutes 5 times a week, Monday to Friday. For people that are in better shape, high intensity exercise, it would mean, jogging or doing some high intensity training. It's at least 75 minutes per week. So if you divide that, within 5 days, you could do maybe 30 minutes 3 times a week of high intensity exercise. In terms of diet, especially for patients with already known heart disease, the two most likely to be recommended when you go to see one of your physicians would be the DASH diet, which is indicated for people with hypertension. That would emphasize eating fresh vegetable, fresh fruit, decreasing the salt intake, limiting the amount of sodium in diet to about 4,000 to 5,000 milligrams. To translate that into English, it's about a teaspoon of salt, during 24 hours. Mm-hmm. Also, you can hear about the Mediterranean diet. So that means very similar to the diet that used, to be common in Europe, especially Italy, Greece. That would include also fresh vegetable, positive fats like olive oil, fish. All these tend to be safer, for your heart. And then we also try to emphasize stress management. Obviously, especially during this pandemic, the levels of stress in many patients have skyrocketed. So we try to actually have some pastime. I think that's the most important thing that I can tell you. So try to free your mind from mm-hmm. what get you really worried during the usual day life. So in that sense, exercising can also contribute with de-stressing. I think family support and group support is also important. Keeping good communication and relationship with your family and your friends, and always been proven and also in studies that can decrease your levels of stress. Having pastimes, painting, playing an instrument, learning a new language. So all these things, can kind of free up your mind and distract you from your daily life and levels of stress. All these things, can contribute to decrease the modifiable risk that we can control to prevent heart disease.
So you kind of highlighted how to avoid some stress on your heart. I have some family members who are younger than me who, they're out exercising. They start to run. Oh my goodness, I feel a little weird. I don't want to cause any. So they stop exercising. So can you kind of walk through where you really want to pay attention and where you might want to overcome some of that anxiety to really get proper exercise?
So coming back to my first, the second question. So what the American Heart Association recommends is not really having heavy exercise. If you think about it, like exercise, like walking, 30 minutes a week, it doesn't really require, high intensity training. So I would say that pretty much everybody that's able to ambulate should be able to walk, for that amount of time at steady pace over, 30 minutes, 5 times a week. Obviously, depending how fit the patient is, you can increase your exercise intensity. I also try to always recommend patients, and I just had a conversation with a patient a couple of days ago. So some specialists trained, to actually help people, to build up their strength, and also some people trained to become, dietitians and, guide people on how to eat better, eat healthier. So a lot of patients, try to do everything on their own, which sometimes works, but it might not be the ideal way to do it. So if you go to see your primary doctor or your cardiologist, usually we work in collaboration with other specialties, and we can always try to hook you up to the right people, the right specialists. If you feel that your level of exercise tolerance is not the best, and even having light exercise make you uncomfortable, we can always try to connect you with cardiac rehab and get you fully evaluated and decide what is your best level of intensity in terms of exercise. If you don't feel comfortable, following a diet that you don't really are able to manage, we can also try to connect you to dietitians. There is a lot of support. Preventing heart disease is not one person, endeavor. So it's a team approach. So primary doctor, cardiologist, endocrinologist for patient with diabetes or even with hypertension, nutritionists or dietitians, trainers, all these can really contribute to actually approaching this risk factor modification in a better way. So I'm a big proponent of having people referred to the specialist. I mean, I can give you a copy of any of these diets, but it's never the same as somebody that was trained, properly trained for 3 or 4 years to be able to help you, through this process. And the same applies to exercise. Walking is a fairly safe, activity. If you don't feel comfortable or you would like to take it to the next step and try to exercise more and be a little more active, it never hurts from my perspective to have somebody that has been trained, professionally trained to help you, achieve your goals. So if you have your goals in mind, so we can always help you also to connect to the right people if that's what is needed.
So if we got 15 minutes here together, we've raced through a lot of information already. So if they're watching just 30 seconds of this, what would be the most important thing to relate to them? What are the 3 most important factors in managing the stress or the risk? What in 30 seconds, where would you say focus here?
My focus, I always say, is prevention. And I tell all this to my patients every time. So you never want to develop heart disease, because once you develop heart disease, that comes with a different, ball game and different indications and treatments. So the idea is to try to prevent, getting there. And some patients have, higher risk factor than others, and eventually it might happen, but we try to delay heart disease for as long as we can. I have hopefully prevent them forever. So the main goal would be being preventive, trying to decrease your risk. And in that line of ideas, working with your primary doctor, your cardiologist to identify your risk factors is the main goal. Some people go around, being hypertensive, having high cholesterol, having diabetes, and they never knew because they never went to the doctor to get checked to begin with. So ideally, prevention, going to your doctor only for routine visits at least once a year, make sure that your levels are normal, that your blood pressure is normal, that you don't have diabetes, and if you have it, you can approach it, and attack it very early on. You can start treatment early, so that way we can delay developing heart disease. And also being able to identify the risk factors that you can control, because there are some risk factors that we can't. like your genetics. If you have, parents with heart disease, so you have to be very mindful that you may have, some higher risk. So you have to be aggressive trying to modify what you can. So that's what I would recommend, trying to prevent heart disease, because once you develop heart disease, it might be a little more difficult, and then you will be committed to taking, medication, having some different therapeutics, probably lifelong, probably.
So you mentioned that it's really a team approach, and of course, AdventHealth, has a lot of this. So can you talk a little bit about how you work at AdventHealth and how AdventHealth approaches the cardiology department and the services available?
Yeah. So luckily, relatively new for AdventHealth, but I've been here for a few months now, and I work in close collaboration with primary care doctors. So we have a quick, way to refer patients to cardiology if they need to be evaluated for high risk, presentations or having active symptoms. So we work in the same building. Actually, you can walk from one office to another. Sometimes the patient, if they are active when they go to see their primary doctors, they are referred to our office, so we can see them the same day sometimes. If not, we can try to accommodate the patient as soon as we can. And the same applies to other specialties. So as I said, I'm a big proponent of having the patients see their right specialist. So since I got here, I've been talking to different specialists, and I refer the patient that I feel are appropriate to be referred to different, members of the team. So we can have the patient always seen by dietitians, by cardiac rehab, which I think is very important. We also have referrals to lung doctors. Sometimes there is overlap between cardiac symptoms and pulmonary symptoms, asthma or COPD. Also for sleep apnea, we have a very straight line to refer patients. So we can attack all the different risk factors and try to prevent progression of disease and many different aspects. So because we have the availability, so if we have patients that actually require to be seen by different specialists, we always try to connect the patient to the right people. And on the same line, so because we have a wide variety of patients, we have Spanish-speaking patients, we have English patients, so we try also to connect the patient to the right specialist. If the patient is Spanish-speaking only, we try to send them to one of the providers that speaks Spanish, so we can streamline communication and make everything, or deliver care in an easier way for the patient.
Outstanding. So 15 minutes goes by quick, and we are coming up on it. Is there anything we missed? Anything else you want to touch on for the benefit of the audience here?
So again, my last thought would be, again, prevention. And if you would like to establish care with cardiology, we're happy to see you at AdventHealth. We have multiple locations that we are happy to accommodate the patient if that are in need of cardiac care. So we see people, I myself in Celebration, in Kissimmee, or part in Settlement. And if you come to see us, we'll try to optimize your treatment if you already have heart disease. And if not, what I always say, we'll try to prevent it. So we try to identify your risk factors and try to control them before it becomes an issue.
Fair enough. And so hopefully this reminder lasts through all of February and beyond, that this is American Heart Month now, but the heart's an important part of the body. And there are specialists in our community who can walk you through that and make sure you stay healthy and fit. We may just do a quick reminder since we're on the health topic. I know we're talking health, but masks and hand washing still very important. COVID's still out there, and that I've seen some reports that can impact the heart. Can you just maybe give the audience a reminder about why that's important as well?
Right. So we know also that the virus can affect the heart in many different ways. It can make arrhythmias, more active in people with arrhythmias, and even in those without arrhythmias, it can also weaken the heart, give you heart failure. It can also increase the coagulability, can promote, hypercoagulable states and blood clots that could eventually give you heart attacks or pulmonary embolism. So if you have COVID or you had it before and you're having symptoms that are also concerning to you, like worsening shortness of breath, chest pain, dyspnea, I wouldn't hesitate to go to the ER. And also I would apply the same to patients with heart disease that are becoming more symptomatic. That means having more shortness of breath, more chest pain, lower extremity edema. If you feel that something is not right, so I wouldn't hesitate to go to the ER. As I always say, it's better always to prevent heart disease. But if you have it and you have to deal with it, it's better to do it, promptly as soon as we can.
Well, I appreciate that counsel, and definitely appreciate you joining us today to share your knowledge. And this is an important topic, and AdventHealth is a tremendous partner to the Chamber. So we thank you for sponsoring. We thank all you do in the community, and we look forward to maintaining that partnership and working together to keep our community healthy and strong. So Dr. Solano, thank you for being with us this morning. Again, we're Champions for Business Community, along with our host today, AdventHealth, and we hope to see you again next week. Thanks for being with us.
Much. I appreciate your help and everything you do, guys.
Thank you.
Thank you so much.
Thank you.